Peptic ulcer prevention and medical treatment. Peptic ulcer usually appears after the age of 30 years. Mostly the type of duodenal ulcer is common amongst the public. The main preventive measure is reduction of the stress, fear, depression, and anxiety, and similar neurological and psychological factors. Secondly, reduce the intake of fast foods, spicy foods, and the commercial drinks. Reduce the intake of alcohol quantity, quit tobacco smoking, have a regular aerobic exercise, and use the cholesterol free diet and also the lesser quantity of the triglycerides in the food material. Use fresh fruit and the vegetables. Mediterranean diet is preferred to maintain the healthy weight. So these are the preventive measures. Take excess quantity of the purified water. Stay hydrated. Now the main cause of the ulceration is H. pylori infection. So for that we have to eradicate the bacteria in the stomach by the antibiotic therapy. So the antibiotic mostly used are clarithromycin 500 mg in BD dose for 2 weeks, amoxicillin 500 milligram BD for 2 weeks, flagyl or metronidazole tablets 400 milligram BD. So these are the medical treatment for the eradication of the H. pylori. Along with this PPI, that is proton pump inhibitor, PPI proton pump inhibitors medicines. I mean the omeprazole, esomeprazole and other similar medicines, they are used to reduce the production of the hydrochloric acid in the stomach. The other medical treatment is antacids. These are the drugs which reduces the or neutralize the acidity of the stomach and relieve the pain. But they are not a remedy or the medical treatment for ulcer. But they relieve the pain and produce comfort to the patient. Histamine 2 blockers, they are used in the form of syrup tablets to reduce the acidity in the stomach, and these are the medicine famotidine, cimetidine and ranitidine. Similarly, PPI is mostly and widely used in this period for reduction of the acidity and production of the hydrochloric acid. So proton pump inhibitor medicines, they are mostly recommended. Complications of ulcer. When the peptic ulcer is almost a chronic disease, so there are various stages of the ulceration. First stage is limited into the mucosal layer. When second layer it penetrates into the lamina propria, and then next is the muscularis mucosa layer. Then it enters into the peritoneal cavity, produces peritonitis, and also an inflammation of the other organs situated in the abdominal cavity like gallbladder, pancreas, spleen, that produces irritation and inflammations. So there is an extension of the disease inside the abdominal cavity. Bleeding of the ulcer leads to the loss of blood through the vomit and the stool and may produce shock conditions. So it may become emergency due to excessive loss of the blood. Next is the blockage because there is inflammatory overgrowth of the mucosa that produces obstruction in the gastrointestinal tract at the level of duodenum and the pyloric antrum. The pyloric sphincter is narrowed, so the onwards passage of the food stuff digested by the stomach propelled onwards is hindered or the tackled or the reduced. So that produces loss of weight, weakness, anemia. So these produces fatigue symptoms due to the deficiency in the food stuff provision to the various organs of the body. So these are the complications. When the ulcer is in advanced or progressive stage, then surgery is performed to close up the ulceration or the cut the disease portion by the surgery. So in this disease, the role of endoscopy is very important. Upper endoscopy that is very beneficial for the early detection of the ulceration to avoid the carcinoma formation. So it is a therapeutic as well as the diagnostic process or the device, and it is a very beneficial one, and it is almost painless and has no side effects. So peptic ulcer is disease of the contamination of the H. pylori. So the regular test of the H. pylori is necessary for every person once annually to avoid the onset of the peptic ulcer.